let me thank everyone for being out. Let me thank y'all for being out again. Of course, today we're at the second mega site that's been set up in collaboration with the city of Houston here at Minute Maid. And also I'm joined today by Dr. David Purse, the Chief Medical Officer for the city, Kaylin Henderson, the Deputy Assistant Director for the Health Department. She's representing Director Stephen Williams, Jordan Handel, the President of Davico, which is responsible for this testing site. And I want to thank Jordan for their collaboration with the city of Houston. We have seen both with the explosion of COVID-19 cases here and around the country, combined with the concerns that people have surrounding COVID-19, that testing is a critical component, and the city has been working in collaboration with our partners to ramp up as much as possible. In addition to vaccinations, boosters, masks, testing is that additional layer of protection that we can help protect us from COVID-19 and specifically the Omicron variant. The Houston Health Department and its network of partners provide a lot of testing opportunities for the city of Houston. We recognize that the demand is here right now. We anticipate the demand will be greater next week as people prepare to go back to school. People are coming back from the holiday break. People are celebrating over this weekend. So we want to do as much as we can to ramp up the availability of testing. Davico is one of our valued partners with this new drive-through mega site at Minute Maid Lot C. I want to thank Davico, it's a crane company, for again stepping up to the plate to serve Houstonians. Yesterday, on the first day of operation here, they tested 1,018 people with dedicated staff staying several hours late. I think you all seen the demand that took place here on yesterday. The initial schedule was for this site to do up to 400. But they ended up having more than 1,600 or more registered, and so they were able to test 1,018. And I applaud these hardworking folks and appreciate their commitment in providing a much-needed service for our community. Today, there are about, hold on, this wind is not being nice. Today, there are about 800 appointments scheduled with another 650 tomorrow. So they will be providing testing on tomorrow, not on Sunday, and it'll pick back up on Monday, and they can speak to that. The appointments today are about half of what we saw yesterday, so this will be reduced. This will reduce the wait time. As you can see, there's not a wait time. And I also must commend Davico, who is committed to scaling the operations to meet the increasing demand. I'm also glad to announce that next week, we will open 2 additional mega testing sites. One, in partnership with United Memorial Medical Center, UMMC. That would be at Butler Stadium in Southwest Houston near South Main and the Fort Bend Tollway. So that will start up next week. And the other mega site will be at the old Dave & Buster's at 6010 Richmond Avenue in partnership with Express COVID Testing. Both sites will have the capacity for 1,000 daily tests. And then we'll announce more specific details for those 2 sites and others when they are finalized. So we recognize there's an increased demand. We want to do everything we can to provide people with good choices, places that they can come where you don't have to pay, that are free. And so we want to encourage people to utilize the City of Houston's health sites and those sites where we're working in collaboration with others. That's the best way to get it done. And we want to make sure that we give you an experience that will not take advantage of anybody in the city. We spend Wednesday at the Del Mar Stadium mega site in partnership with Curative, which also provides 1,000 daily tests. Since opening on Wednesday, they have exceeded that number of 1,000, providing 1,149 on the 29th, and then 1,179 tests on yesterday. At full capacity, the Health Department's network of affiliated sites can provide more than 30,000 daily tests now, and the goal is to be up to about 35,000 by the end of next week. So you can find appointment information for this site in our health department's network of sites at houstonhealth.org or by calling 832-393-4220. So let me stop and let me first bring on Kaylin Henderson with the Houston Health Department, the Deputy Assistant Director.
The Houston Health Department continues to pivot and scale up our operations to meet the demands of this pandemic. As Mayor Turner has stated, we are very fortunate to have a network of partners that provide COVID testing as well as COVID vaccinations. When our testing sites reach capacity, the individuals at that site will provide you with a list of sites that you can go to that are nearby that do have available appointments. Getting tested or vaccinated at a Houston Health Department or affiliated site is at no cost to the individual, nor do you need to show proof of citizenship, residency, or insurance. And as Mayor Turner has stated, Minute Maid Park will be open tomorrow, as well as Acres Homes Multi-Service Center. You can find nearby sites, schedules, and make appointments at houstonhealth.org, or you can call 832-393-4220 to reach a live agent. In addition to our health department affiliated sites, vaccinations are available at your doctor's office, clinics, pharmacies, and various providers.
Dr. Purse.
Thank you, Mayor. Thank you, Kaylin. Just want to remind everyone that, as you know, the Omicron variant of the COVID virus is extremely contagious. We're seeing the numbers go up rather dramatically. The good news is, as you know, is that a small percentage of those individuals who are becoming ill are requiring hospitalization. But as I've said before, a very small percentage of a very large number is still a big number. And so our hospitals are going to be faced with this. This is why it's so important that we do everything possible to flatten the curve. That's a term we haven't used in a long time, but we really need to try and flatten the curve now. It is apparent that many, many people will become infected. It is apparent that the vast majority of them will only become minimally ill, but some of them will require hospitalization. That we need as a community to work together to make sure that doesn't all occur at the same time. That's why getting tested is so important, because we also know that with the Omicron variant, just like Delta before it and Alpha before that people are generally infected and spreading the virus for a day or two before they even have any symptoms. This is why it's so important that people get tested regularly, not just once, but regularly, so that should they happen to be infected, they can then turn around and isolate, which means that the one group they're most likely to protect is the one group that they're also most likely to infect if they don't know it. That is your own family. So we all care deeply about our families, so let's do everything we can to protect them by getting tested regularly, getting vaccinated, and also all those other things. So wearing masks. We are all wearing masks today. We're gathering outdoors. These are the sorts of things that we want other folks to do, especially over the holiday. These really work. If you are indoors, especially, you should be wearing masks and thinking about social distancing. These things really, really work. The last thing I want to point out is that we are seeing that among the folks who are testing positive, this is very early data, it's not a surprise that we are seeing a lot more people testing positive who are unvaccinated than those that are vaccinated. We're also learning, and I actually have a number of this, it appears that of those who are vaccinated, they're testing about 5 times more frequently than those who are boosted. So if you are eligible for a booster, now is the time to get it. Do not delay. If it's been 6 months since your mRNA vaccine, or if it's been 2 months since your original J&J, now is the time to get that additional shot. It really works. And so a lot of these folks who are becoming infected and only minimally ill, we believe that has a lot to do with the number of folks in the community that have some level of immunity from previous vaccination. And that's why they're not getting hospitalized. So let's also remember that getting hospitalized costs thousands of dollars. The vaccine, like the testing, are free. Thank you.
Thanks, Dr. Purse. Jordan Adele, President of Davico.
Thank you, Mayor. Appreciate
Thank
this.
you, Jordan.
And to the health department, thank you very much for the partnership. Appreciate that. We're very happy to partner with the City of Houston and to be one of the organizations to help support this important endeavor. Yesterday, I think, further highlights the demand that Houstonians have to be able to easily access COVID tests in this new variant that we're facing today. We'll continue to expand our operations and scale to the demand. As we can see today, there are no waits, which is good for those that want to get tested. Please come down here today. There is no line whatsoever. Again, it's free. So as an organization, we're committed to supporting the City of Houston and those demands that we see today. Thank you very much.
Thanks, Jordan. And I do want to underscore what Dr. Purse said. Just because, for example, you may have gotten tested a week ago, doesn't mean that, you know, it's done for you. You do need to get tested on a regular basis. That's important. So if you got tested a week ago and you've been around a lot of people, might be good to get tested again, because this Omicron virus is so contagious. And then I want to emphasize the importance of getting boosted. You know, you may have been vaccinated, but you still need to get boosted. That would help to keep people out of the hospitals, people from getting seriously ill. And we want to do as much as we can to work collectively as a community, so that in January, hopefully mid-January, we can start to see some positive improvement in these numbers, okay? But that means that we've got to work together as a community in order to do that. I want to again re-emphasize, there's no reason for you to be paying for tests. So if you're going to some place and they're asking for credit cards and ask them for money, there's no reason to do that. You know, leave that place. You can come over to Minute Maid right here in Lot C and get tested, and it's not going to cost you anything. At all of the city health facilities and those that we are partnering with, we are not charging, we're not asking for credit cards, none of that. So please don't allow yourself to be scammed. But I do encourage people to get frequently tested, and we're ramping up our capacity in order for you to do that, to reduce the number of wait times. So let me pause and take any questions, and then I'll come back on another subject matter after we deal with the vaccinations. Yes, sir.
Mayor, on yesterday, it looked nothing like this. It was, cars all around. My right, you guys left. There's only 2 porta potties, and people were here for like 4 and 5 hours, and they came up to us, telling us, hey, this is ridiculous. We're in our car, we can't use the restroom. And this is for anybody who has answers to that. Is there a solution for that? Because we had multiple people yelling at their cars, hey, we gotta use the bathroom, and there was none for them.
Yeah.
There's padlocks on the only 2 that are here today.
And I'll let Jordan speak to it, but I will say yesterday was an anomaly, because due to a computer glitch, instead of taking up to 400 registrations, which was the maximum, the computer stayed open, and you had over 1,600, and I think it might have been larger than that, who actually registered. So so that was a computer glitch, because yesterday the cutoff was supposed to be 400, but it kept registering people, and so people signed up, people came, so you had a lot of people. And that's why I want to thank Davico and the staff, because they decided to stay as long as possible to take on to test more, and that's why over 1,000 people yesterday got tested. And so that created that long delay. We have that issue has been corrected. But let me yield to Jordan. I thought if I
No, that was pretty much it, Mayor. Thank
okay, so we've corrected that, and now as you can see, there is no wait time, and we do want to encourage people to utilize facilities. If you have to use the facilities, we want you to do that, and that's whether here or at any of the city facilities. At the clinics, for example, you have to use the restroom, you use the restroom, okay? That's what they are for, and so we want to make it as convenient as possible. We want to test people, we don't want it to make it inconvenient for people.
But just to clarify, people have to schedule an appointment, correct? They can't just drive up, or
They can schedule an appointment, but Jordan,
Yeah, thank you, Mayor. Yeah, so the goal is to have them schedule an appointment so we can have this process as efficient as possible. But to be clear, if somebody shows up, we're gonna test them. We're gonna schedule an appointment manually through our iPads and ensure that those that are here, even without an appointment, will receive a test.
I was told earlier that you had to have an appointment. They couldn't take anybody else because it wouldn't enter into the database.
Unfortunately, I'll work with my team offline, but that's incorrect. Any individual that's here on site, we will ensure they are tested.
So are there enough tests right now to where if someone watching this wants to get a test here right now, they can drive up and get it?
Absolutely, yes. We have plenty of capacity within the city of Houston, as well as this site, to test those that arrive.
And what's the number of people that you can test here?
So today we capped it at just shy of 700. So we have plenty of staff and plenty of resources to support that need. We're going to scale next week to get to 1,000 a day.
And do you, by any chance, I know it's early, know how many people have been tested so far?
As of yesterday, it was just north of, I believe, 1,500 to 1,600, or in that range itself. Today we have just north of 300, so we're about halfway through the day, and halfway through the allotment of tests.
You open, and how long?
Today we are open till 5 o'clock.
4 o'clock.
4 o'clock, excuse me, 4 o'clock.
And then tomorrow, 8 a.m.?
Tomorrow, 8 a.m. to 4 p.m. We'll be closed on Sunday and then resume normal operations on Monday.
Mayor, can you talk to us just about the difference today? Was it the New Year's Eve rush and trying to get tested before people went and celebrated with family members? What do you attribute?
I think that's part of it. People are getting geared up for New Year's Eve and New Year's Day, so they wanted to be tested. Another part was, for example, it was the computer glitch that ended up registering, way more than what was previously scheduled. So that created a log jam. Look, we're trying to work things, smooth things out. At the very beginning, it's going to be a little bit rough. But I think as we get into next week and as we ramp up more mega sites and more testing centers, there will be more than adequate capacity throughout the city so that people can the goal is for people to come in without a long wait, get tested, and then get their results back as quickly as possible. That's the goal, so that we can avoid long wait times. We want to make it as convenient as possible and as accessible so that people can come in and get tested. That's the way to get on top of this virus and for start driving the numbers down. So that's the goal. We'll keep ramping up testing through the month of January, and then hopefully by the end of January we'll be in a different space at that time.
Mayor, we saw a press release from Governor Abbott today that he's put in a request to FEMA for more testing sites in Harris County. Have you heard any details about that request, or if not, general reaction to trying to get more testing down here?
Well, I think it's good. We certainly welcome that. I think it's important for all units of government to be working collaboratively. I don't think you can have too much testing, okay? And then we need to make sure that testing capacity remains throughout. As long as COVID is around and there's a possibility of another surge, then we need to maintain that capacity throughout. So it's never enough. I certainly welcome what the governor is doing. It could certainly complement what we are doing, but we're ramping up even now, as you can see. So we'll continue to do that. And again, the goal is to be able, just like you can go into your grocery store and pick up something, the goal is for you to go to a testing site, get tested, walk out, and not be there very long.
Mayor, you mentioned that not going to other testing sites and paying or anything. Is the city of Houston, if they are doing anything, are they doing anything to crack down on pop-up testing sites that aren't delivering on the promise to provide tests between 28 and 48 hours? Some of them have closed and people don't know what they're doing with their personal information.
Kaylin, any information on that? Dr. First, on the pop-up testing sites?
So with those pop-up testing sites, you are able to call our call center, 832-393-4220, if you have a complaint or a concern regarding any of those non-affiliated HHD sites. Those information will come to myself. I then partner with HPD so that we can work and look and investigate those sites.
And just to follow up to that, since COVID testing sites are not regulated in the state, is there anything that HPD can actually do, and how do they go about investigating that?
So I'm not able to answer that. HPD would have to answer that, but I can look into that and get that response for you.
What I would say, I would encourage people to go and look at the sites that the city of Houston, the healthcare site, where we are partnering with various partners. Those are the sites that you should really go to. Okay, I know there may be people who are popping up and offering testing. I wouldn't necessarily trust those pop-up sites. And again, if anybody's asking anybody for any money or their credit cards, that's an absolute no-no. So you need to pass those by.
To your knowledge, do you know if the city of Houston is investigating any of those, and if you do, how many?
I don't know, but I certainly will check with Chief Fenner.
Question two, there are also some small businesses, some that we talked to today, that are going through kind of a similar company and providing testing for those who come through, their members or whatever, or what have you, and also members from the community that need it. Does the city plan on partnering with more even local businesses or such like that to make sure that there's more access to the community? I
Yeah, the answer is yes. We are looking to expand access, but there are certain steps that we go through before we partner with you. So we check, for example, to make sure that the lab is legitimate. So the health department will go through and make those checks. We want to make sure that what you are offering, that you certainly have the capability of doing that. Otherwise, it defeats all of our efforts if people end up going to certain sites that we are partnering with and they don't meet our healthcare standards. So between Director Williams and his team, Dr. Person and his team, we want to check out every single person that seeks to partner with us, because once the city of Houston puts its name on it, we are standing, we are vouching for the efficacy of those particular sites. So every site, every lab has to be vetted before we sign off. If it's legit, if they can provide the services and they're credible, then we are more than happy. And then if you're willing to do it and you're offering free testing services, that's also an added component. But if you're trying to charge or asking people for their credit cards, asking for cash, that's a no-no for us. Okay? So anybody that we are partnering with will have to adhere to our guidelines and to our standards, and then it's a go. That's why we value our relationship with Davico. We've worked with them in the past, and we know they're a credible operation. Curative, credible operation. And the others that UMMC is credible operation. So we'll continue to work with those.
And on average, how long does it take folks to get the results of their test?
Jordan?
It's typically 3 to 5 business days based off demand. I mean, we try to do it within 24 to 48 hours. So we work within that window.
Okay. Let me shift just to another quick question, since this is the last day. Well, not another question, but another topic. Since this is the last day of the year, and as of this morning, December 31st, we have recorded officially 473 murders in 2021, compared to 405 at this time a year ago in 2020. That is an increase from 2020. Recognizing that. That is a 17% increase, which is amongst the lowest percentage increases of 2021 that we've seen in our city. To put in things in context, you can remember, for example, in April, May, when Chief Acevedo was here, he was saying, based on where things were and trending, we could get over 500 murders this year. And then the percentage rates, for example, on July 1, the murder numbers showed a 40% increase compared to the same time last year. August 1st showed a 32% increase. September 1, a 30% increase. October 1st and November 1st, we were at a 27% increase over last year. And as of December 1, it showed a 22% increase. So for the past 6 months, and what I want to highlight for the past 6 months, since July 1, our murder rate in the city of Houston, our murder rate numbers have been trending down. Now, even though the number of homicides is higher than last year, in the last 6 months, those percentages of homicides has gone from 40 to 32 to 30, 27, 22, and as of today, that percentage is now at 17%. So it is my hope that this trend will continue as we get ready to leave 21, heading into 22, that those numbers will continue to trend down. I want to thank HPD. I want to thank all of our police officers. I want to thank people in our community to working collectively, collaboratively. It's going to take all of that, and I certainly want to thank Chief Fenner. When he came in, these percentages were very high. When he came in, it was over 40%. As we stand today, that percentage in terms of the increase in homicides in our city is down to 17%. So we're trending in the right direction. It's my hope and my prayer that that will continue. And that's it.
I'm just going to ask you to follow up to that. What would you attribute those percentages going down, trending down?
It's been a collaborative effort. HPD has done a yeoman's job. That's important. The number of cases that's been resolved, that percentage has gone up. So that's been pleasant. I mean, that's been positive. The courts are now being tougher, which is good. Not providing as many people with multiple bonds. That's a plus. So the ecosystem is starting to come back together. And then the community. I want to thank them for their collaboration, for their partnership, providing information, Crime Stoppers, for example. So it's everybody playing its part, its role in making it happen. Again, the numbers are trending in the right direction over the last 6 months. We just want to make sure that as we enter in 22, that trend will continue, and hopefully by this time next year, we'll be back to where we were, much closer to, let's say, 2019. That's the hope.
And as you look ahead to 2022, any additional steps that you're considering or that you're planning to take to continue to bring that range?
We're going to continue to double down on all of our efforts. You know, we're continuing, for example, on hiring more police. We're going to continue overtime. We're going to continue the use of technology. You know, there's an item on the agenda for this coming week dealing with shot spotters. We'll continue doing that. We'll continue to work with our community partners and investing in communities that have been underserved and under-resourced. That's going to be important. I continue to encourage the criminal justice system, our judges, to be very, very sensitive and not be so willing to grant these multiple bonds to people who've been out 2 and 3 times on multiple bonds. That's going to be important. Trying more cases, okay, reducing the number of backlogs of felony cases than others in our criminal justice system. All of those things working collaboratively, I think will have a positive impact on the public safety within our city. Okay. All right. Thank you all so very much. Okay. Thank you all.